So our group will talk about health crisis, coping with stress and anxiety during medical emergencies or chronic illness.
Here is the introduction. A health crisis, whether triggered by a sudden medical emergency or the diagnosis of a chronic illness, often presents significant physical and mental challenges. Such incidents not only affect the person, but also stress their family and friends. Stress and anxiety are common emotional response to uncertainty, lifestyle changes, and the impact on health. Stress, which is not managed effectively, can exacerbate health problems, while positive coping strategies can enhance resilience and help the body recover. In a health crisis, learning to recognize, respond to, and manage stress and anxiety is critical. By seeking emotional support, practicing mindfulness, and seeking professional guidance, individuals are able to face difficult situations and more calmly. This article will explore the description of the emotion of this, the effect, how to manage such conditions, and further conclusions.
Here is the description of emotion. Number one is fear and anxiety. A sudden illness or medical diagnosis can leave a person feeling out of control and helpless. People may fear the worst outcomes, such as life danger, deterioration of their condition, or loss of the ability to live a normal life. Uncertainty about the future often triggers intense anxiety, especially while waiting for the test result or receiving treatment. The second one is feeling of sadness and helplessness. A chronic illness or long-term medical problem can cause grief because people may need to give up their lifestyle, career goals, or hobbies. This emotional response is similar to a sense of loss, a mourning of hope and freedom. And the third one is anger and resistance. Many people feel angry or confused about the arrival of an illness, especially if the cause is unknown or has unfairly befallen them or a loved one. This can sometimes translate into a resistance to the health care system, your family, and even yourself. And then the fourth is guilt and self blame. Some people may question whether they made choice or acted in a way that contributed to the illness, leading to feelings of self-blame and guilt, especially if loved ones are affected. Such emotion often make it difficult to forgive themselves and increase the psychological burden. And the five is loneliness and alienation. Health problems can make people feel different from others, especially if the illness limits social activities. This sense of loneliness can fool pessimists about the future and even drive people away from those who care about them. And last one is hope and resilience. Despite the emotional challenge posed by the health crisis, many people also find resilience and glimmers of hope in themselves. By receiving support and working to adapt, they may find a new purpose in life and gradually regain their emotional balance.
About the effect. First, physical effects. Deteriorating health, chronic stress, and anxiety can weaken the immune system, lead to increased illnesses or delayed recovery, and can cause problems such as fatigue, headache, and sleep disturbances. Increased risk of complications. Stress can lead to unhealthy behavior such as irregular eating, lack of exercise, or ignore doctor's advice, which increase the risk of complication from disease. Second, psychology impact, anxiety and depression, uncertainty about the future, fear of medical procedures, or the burden of dealing with the chronic illnesses may trigger feeling of anxiety, panic, or depressions. Emotion exhaustion. Constant worry and stress can lead to emotional exhaustion, impairing decisions making and mental resilience. Third, social impact. Interpersonal tension. Family members and friends may be under emotional stress as a result of caring for the patient, which can lead to misunderstandings or conflicts. Feeling of isolation. Patients may reduce social activity due to physical limitation, shame, or fear of being judged, which can exacerbate feeling of loneliness and alienation. Fourth, economic and practical implications. Financial burden, medical emergencies, and chronic illness are often accompanied by unexpected financial stress, including hospital expenses, medication costs, disruption of routine, work, study, and other daily responsibility may be interrupted due to health problems, leading to instability in life.
And now I will continue to how to manage the emotion. To mitigate the impact of health crisis, the following response can be taken. First, seek emotional support. Relying on family, friend, or support group can ease feeling of loneliness and provide psychological comfort. Second, seek professional help. Counseling or therapy can help patients deal with their emotion and learn effective stress management strategies. Third, a healthy lifestyle. Release physical symptoms of stress and promote overall health by exercising regularly, eating a balanced diet, and getting enough sleep. Also, mindfulness and relaxation technique. Practicing techniques such as meditation, deep breathing, or yoga can help calm emotion and reduce anxiety. And fourth, learning and planning, knowing about the disease and preparing for the challenges that may lie ahead can reduce uncertainty and increase a sense of control over your life.
For the conclusion, whether it's a sudden medical emergency or a long-term chronic illness, a health crisis can have a profound impact on an individual's physical, emotional, and social life. Stress and anxiety are a natural response to these conditions, but if not managed, can further damage health. However, with effective coping strategies, individuals can reduce their physiological burden and build resilience. By seeking emotional support, adopting healthy coping methods, and obtaining professional guidance, patients can gradually regain a sense of control over their lives amid uncertainty and find new stability. While the journey can be challenging, cultivating resilience and maintaining positive hope is an important strength in the face of these difficulties. Ultimately, managing stress and anxiety in a health crisis is not just about surviving, but adapting, growing, and discovering new inner strengths to help patients and their families move forward for courage and confidence. Thank you for your listening.